Thank you all for being here today. We're going to talk about sleep gadgets. There are more and more of these things coming out on the market, and they're all promising to deliver a better night's sleep. So let's go through them and see what's out there, what they can do, and what's coming in the future. To start out with, in terms of disclosures, I have no commercial relationships to any of these products or these companies. And just because I'm talking about them here doesn't mean that I'm endorsing any of them. And again, we're going to be talking about the pros and cons of a number of these approaches. All right, there are different types of gadgets that are out there now. There are wearable devices that track your sleep and your activity patterns. There are devices, some of which you wear and some of which have other types of ways of trying to help you sleep. And then we'll finish up with some apps and internet-based approaches out there. Let's start with wearables. These are probably the things that we're most familiar with. And all of these are generally wristwatch-like devices that are based on measuring movements. And they're usually worn on your non-dominant wrist, which for many of us is our left hand, since we tend to do a lot of more like writing and other things with our dominant or right hands. And these can range from some of the devices on the left, like the Fitbits that may not have a whole lot of other information other than letting us know if we're moving, and more the activity monitors are built into some of our watches. These various different sports watches or the Apple watches that can record our movements. So what do these monitors actually do? They track our rest and activity patterns. So it's really all about whether you're moving or not. And so when you're not moving, and particularly for periods of time, they have computer algorithms that will define that as sleep. Some of these devices have programs that tell you what type of sleep you're having. Are you having deep sleep or REM sleep, based on the different movement patterns? The advantages of these devices is that more and more they're monitoring more than just your sleep or your activity. They're monitoring other physiologic parameters like your cardiac rhythm for people who have arrhythmias, or maybe even temperature or other types of things. So they can more and more monitor clinical conditions and have sometimes useful health information. The important thing is that there's some limitations to the technology, which I'll get into in a moment, but the technology is continuing to improve. So these devices are likely to become more and more accurate over time. Another advantage of them is that the data from these wrist monitors can also be fed into some of the internet-based therapies for insomnia, so that they can kind of inform the programs to guide you in a better way in terms of how to sleep. At a population level, certainly they've been increasing our awareness of sleep health. On the other hand, there are some drawbacks or caveats about using these monitors. And first and foremost, the data are not necessarily accurate, and the sleep stage data is not reliable. I've tried these devices out myself, some of them, and I can tell you there are nights that even I, a sleep expert, may lie in bed awake for periods of time, and my activity monitor tells me I've been sleeping, and I know I haven't. I also have patients who come in to see me very concerned about their sleep data because their device tells them that they're not having deep sleep or they're not having dreaming sleep. And this can contribute to anxiety about sleep and actually make insomnia worse if you worry about that you're not getting the right kind of sleep. And again, I try to reassure people that the data aren't reliable, and certainly in my experience, people who come in and tell me their devices say they aren't dreaming or having dreaming sleep, when we put them in the sleep lab, if that's necessary for their sleep problems, we find, sure enough, their sleep patterns are much more normal than their wrist monitor has been telling them. Another problem with these devices that it really kind of focuses on the minutes of sleep rather than the quality of sleep. And sleep is not just about how many hours or minutes you're sleeping, but it's also about whether you're getting the right kinds of sleep. And again, right now, these devices are not necessarily super reliable for giving that kind of information. A lot of these devices are on the market, more and more are coming out, but very few of them have been properly validated against the gold standard, which is putting people into a sleep laboratory and measuring their brainwave activity properly with a full sleep study. So they probably are reliable for telling you how many hours you were in bed and when you were in bed, but not always a whole lot more than that. Okay, the next device I want to talk about are blue light blocking glasses, and they tend to look like this, sort of these orange or yellowish goggles. And the rationale for the blue light blocking glasses is that the circadian clock in your brain, which tends to help you stay awake during the day and sleep during the night, is very sensitive to blue light. And in fact, light in the morning when we wake up, outdoor light, tends to be in the more blue range. And of course, as we get towards sunset, it gets more red-orange. And exposure to blue light is a very strong entraining signal to the clock in our brain to tell us it's morning or when it's daytime. And it also increases our activation. So the problem is that if we get exposed to a lot of blue light in the late at night, like when we're watching TV or exposed to our computers or even some of our cell phones or our e-readers, that's going to give our brain a signal to wake up or is going to affect the circadian clock. So we want to really avoid blue light in the evening. So wearing these lenses for an hour and a half or 2 hours before bed, in some studies has been shown to improve their insomnia. Again, there are other ways to avoid blue light. You can get screen programs for your computers that shift the tone of the light away from the blue spectrum. But this is another approach for some people that might be helpful. Okay, this is something that's been around for a while, white noise machines. A lot of people are very sensitive to abrupt noises or unexpected noises. And so if you live in a place either that you've got a lot of traffic noise outside, or your bed partner happens to snore that bothers you, or there's, dripping faucets or whatever it is that's bothering your sleep, having a constant monotonous sound can help you stay asleep because it blocks out these sounds that might interrupt your sleep. And so a lot of the white noise machines will have soothing sounds like wind or rushing water or, leaves rustling in the breeze, those kinds of things. And again, they can help to drown out these intermittent noises. They also may be helpful for people with tinnitus, which is the ringing in the ears. And a lot of people, particularly as they get older, are going to start to experience tinnitus, particularly if you've been exposed to a lot of loud noise earlier in your life. And although a lot of times during the daytime, the tinnitus doesn't bother us because we're inundated with other sounds and not really thinking about it. When you're lying in bed quietly trying to sleep, it can be quite annoying to some people. So that's another place where a white noise machine might be helpful. Okay, now we're going to start talking about some of the newer things coming out, and I'm going to show you a couple examples of cooling devices. I'm not sure when you're listening to this lecture, but I'm giving it right now, recording it in the middle of the heat wave we're having in August. And so for people who don't have really great air conditioning, you may be noticing if your bedroom is warm, that it's a little bit more difficult to sleep at night. And in fact, we know that we need to be in a slightly cool temperature to sleep. So there are a number of devices out there that help us sleep cool. Some of the older devices on the right are either sort of sheets that you put on the bed that are actively cooled by a cooling system, or the bed jet below on the right actually kind of blows cool air in. And one of the latest things is this sleep cap that you wear at night that cools your head down. And we know that one of the places that we're most likely to lose heat is from our heads. So the rationale for this is that it's long been known that either cooling the brain or dropping core body temperature reduces neural activity and promotes sleep. We also know that our brain and our body temperature tend to cool down during sleep, particularly during non-REM sleep. So that's why oftentimes we go to bed feeling a little bit cool, and then we may wake up a few hours later sort of hot and sweaty and throwing the covers off. And it's not because our bedroom has become warmer, but it's because the thermostat in our brain has sort of turned itself down, and we actually want to be cooler as the night goes on and we reach our lowest body temperature point in the early morning just before we wake up. And during sleep, we're actually dumping heat out to help cool ourselves down. These cooling devices causes drops probably in both brain and body temperature. There is evidence for improved sleep with a brain cooling device, but we don't know if it's because it's actually cooling your brain down or it's just sort of cooling you down in general. There's not a lot of data for the efficacy of these cooling devices in terms of actual, scientifically controlled studies, but certainly we know that sleeping in a temperature that's even the slightest bit warm is going to make it difficult for you to sleep. And if you've ever woken up during the night and had trouble falling asleep, particularly if you're sort of tense or anxious, you'll actually notice that you feel warm, and that just before you fall asleep, you're starting to feel a little bit cool. So cooling yourself down is very important, and any of these approaches may help to do that. And I want to also put in a little pitch for women who are peri or postmenopause. At that point, women become extremely sensitive to the slightest difference between their actual skin temperature and the temperature their brain wants them to be. So even just being 1/100th of a degree warmer than your brain wants you to be in terms of your skin temperature can trigger a vasomotor reaction, so hot flashes, and make it difficult to sleep. So make sure your bedroom is cool, and if that doesn't work, you could consider another device. All right, now we're going to go to one of the latest groups of gadgets that's been released to the public, and you can buy these things online. And these are various types of headbands put out by different companies that actually will play tones during your sleep that are supposed to stimulate slow waves or deep sleep. And the rationale for this is that these big, slow brain waves are most prevalent in our deepest stages of sleep. Usually the sleep you get at the very beginning of the night that's very deep is full of these slow waves. And we also know that slow waves seem to be important for some of the functions of sleep, including learning and memory. They normalize the synapses or the connections in our brain, and they also seem to be important for clearing toxic substances from the brain, like amyloid and tau proteins that are implicated in the development of Alzheimer's disease. So we know slow wave sleep is important. Slow waves are only seen during sleep normally. And again, they're somehow involved in some of the functions of sleep related to learning and memory and sort of housekeeping in the brain in general. And the way that these devices work is the person was wearing a headband there to the left, and there are some electrodes that are actually recording brain waves, and those EEG or brainwave signals are being delivered to a computer. And when the computer detects that the person is entering non-rapid eye movement sleep or starting to have slow waves, and deep sleep is detected, they're sort of on the bottom, it will start to play tones to stimulate and enhance the production of these slow waves. Now, what's the evidence for whether this works or not? There's certainly a number of studies that have shown that these devices can increase slow waves during sleep in normal, healthy subjects. The effects seem to be most evident in younger people, so less than 40 years old. And unfortunately, they don't work as well in people who are over the age of 40. So unfortunately, the populations that might best benefit from them may or may not be as effective. They don't seem to increase total sleep amount. They may or may not affect the stages of sleep. And we don't really have much data as to whether they improve our cognitive function, our daytime function, our physiology. Do they clear toxic substances out of the brain better? We just don't really know. But again, these devices are really, just starting to be developed. More research is needed, and I'm sure a lot more data will be coming out soon. As you know, with many devices, just because a device is FDA approved, it doesn't mean it is effective. It just means that it's probably not going to hurt you. This is a little bit different than FDA approval for drugs, which require that they not only have to be safe, but they have to actually do what they claim to do. So we don't know yet on all these devices whether they're going to be that helpful yet. Now, there's some other types of approaches in terms of brain stimulation and devices out there. Some of them use pulsed electromagnetic frequency, so just basically magnetic activity that are supposed to increase your slow waves. And there's another device that uses actual electrical stimulation where you put electrodes on either side of your head by your ears there, and that's going to stimulate slow waves during sleep. The rationale and the results for these devices, again, the electromagnetic stimulation is like mild transcranial magnetic stimulation. So TMS, or transcranial magnetic stimulation, actually is a therapy that is approved for certain disorders, particularly being used now in a number of psychiatric disorders like major depression, but that needs to be delivered in a medical setting. This PEMF device is much, much milder. The cranial electric stimulation is like super mild electroconvulsive therapy. It's not going to give you a seizure, very, very mild stimulation. These therapies were actually both developed for mood disorders and for pain relief, and there's sort of more data related to that. We don't really know what the mechanism is for how they're going to improve sleep. They supposedly cause some deactivation of the brain after application, but there's really very minimal data on sleep effects and really just some self-report data. And one study really didn't show much efficacy. So these things are out there, but probably not something to really consider for sleep at this time. There are some newer approaches under development, and these are not yet out there on the market, but some of them are kind of interesting. So again, this transcranial electrical stimulation and transcranial magnetic stimulation, these are therapies, again, that are used for research purposes, and in the case of TMS in psychiatry, are sort of more top-down types of approaches, and there are products under development. The advantage of these types of stimulation approaches are that they can be targeted to specific brain regions, and we're learning more and more about where we should be stimulating on the scalp to actually help improve sleep. And these devices can actually be targeted to various brain EEG waveforms. So not just slow waves, but also sleep spindles, which are implicated in learning and memory as well. And a lot of these devices, again, are are not only being developed to help improve sleep, but also to help improve cognitive function, since we know as sleep and various of these sleep waveforms are important for learning and memory, and to see, could they be an effective treatment for disorders that involve problems with learning and memory, like dementia. In addition to the auditory stimulation, there are products under development using other kinds of sensory stimulation, and there have been studies done using other types of sensory stimulation. And almost any sensory stimulation can entrain or affect brainwave patterns during sleep, such as olfactory smell, visual stimulation, light pulses, sensory stimulation. I've got visual there twice, sorry about that, and vestibular. So that's actually a really interesting study. I've got a picture here on the left. So that has to do with rocking. So we are all familiar, I think, with how rocking is helpful for sleep. We put babies in cradles that rock. I know when my kids were little, I used to use a swing to help them sleep, and a lot of, which we don't advise anymore because then they get dependent on that. But many bassinets or other baby cradles involve rocking. Well, there were some studies done recently that showed both in mice and in people and in adults that rocking stimulates slow waves. So rocking does help deepen sleep. So I wouldn't be surprised if at some point in the future, in addition to all these beds that raise and lower themselves, that we may end up seeing on the market beds that rock you even when you're an adult. Okay, I'm going to finish up with some devices that we're all a little bit more familiar with, and again, where there are some data to suggest that they could be helpful. And one of those devices is a clock. So we know that one of the things we can do to improve our sleep, and a basic principle of sleep hygiene, is to try to wake up at the same time every day. And we also know that exposure to bright light in the morning every day also helps to entrain us to wake up at the same time every day and strengthen our rhythms. There are a lot of clocks out on the market now that sort of have a sunrise component to them, meaning that they start to glow in the morning at the time you should wake up, and they get very bright before an actual auditory alarm goes off. And these may be useful to help us wake up. I actually like these clocks also for people who have insomnia, because one of the bad habits that we all get into is that when we wake up at night, the first thing we do is we check to see what time it is. And in general, that is not a useful tactic, because when you check to see what time it is, you are actually not only perhaps stressing yourself because I've only slept an hour, I'm never going to get back to sleep, or I only have an hour to sleep, I'm never going to get back to sleep. We generally don't think good thoughts when we look at the time at night. And secondly, we actually can keep track of time in our sleep. And when we keep checking the clock, we sort of get into these habits of I wake up at 2 o'clock every morning, and unconsciously you're actually training yourself to do that. So the idea of having a clock like this is that they usually start to glow about a half hour before it's time to get up. And we advise using one of these and turning it in such a way that you can't see the time. And as long as it's not glowing, you go back to sleep and you don't pay any other attention to what time it is. So, and again, the light stimulus may also help to deliver an entraining stimuli or signal to you. And again, the rationale here for these devices is the light wavelength and intensity entrain our rhythms. They have alerting effects. Our circadian system is sensitive to blue light. These light emitting clocks can both stimulate sundown and sunrise, so they shift to be more red at night, and that's the kind of light you want to have before you go to bed, more blue in the morning. And they're also very effective for people who are hearing impaired and won't necessarily hear an alarm in the morning. Okay, so something that's kind of sort of a device, and that is cognitive behavioral therapies for insomnia that usually are provided by a therapist that you either go in and see in person, or these days we do on Zoom, but there are computer-based forms available. And what has been determined using controlled studies is that computer-based forms of cognitive behavioral therapy are effective. They're highly acceptable to people who use them, and that at least 1 in 4 patients will recover from chronic insomnia with these approaches, and or at least get somewhat, and more of them will get somewhat better, but still might need some more help from a trained professional. A couple of examples out there. One is Sleepio, and this is something that is marketed direct to consumer. That has a cost attached to it. The Veterans Administration developed an app called CBTI Coach, and that's free and has been used quite effectively in many, many people, and you can go out there and get it yourself and try it out. So that's kind of the summary of gadgets out there. This is a field that's exploding, and more devices and gadgets are going to be available, and the technology continues to improve. But hopefully this will give you a little introduction, and at this point I'm happy to take any questions. Thank you again for your attention.